All right, thanks, Keith. And now we talk to our county health officer, Dr. Henning Ansorg, who has the latest on the pandemic. Good morning, Dr. Ansorg. I've been just sitting there for 2 years watching you at the Board of Supervisors, guiding the ship through this crisis. And so happy to be here with you today. Joey couldn't be here, but he left me a long list of things to talk to you about. We're going to hit some of the bullet points here. First of all, good morning, and what have we got in the way of new medications that we're hearing that are out there today that you can tell us about?
Yes, good morning. It is really encouraging that we now have, tablet form medications that can really deal with this virus early on and prevent people from getting really sick, needing hospital care. That is a really wonderful new development.
And we're getting into a new phase, it looks like, or we're veering that direction, the endemic phase. Tell us what we're in for that, and what the public should expect as we transition out of this surge, which looks like it is starting to teeter a little bit and come down, and get into the next phase of living with COVID on some level for some people.
Yes, that is obviously on everybody's minds, and such an important question. Now, I am, cautiously optimistic, but we have to understand that this COVID virus has thrown us so many curveballs that we are very hesitant to give a very confident prediction. But I think for the virus to no longer be in a position to really, interfere with our normal life, or to overwhelm our healthcare system or make so many people sick, we need certain things to be in place fundamentally. And that is, we need a lot of people to be immune, either due to previous infection or to boosters and vaccination. Second of all, we need much more of these antiviral medicines that can be taken to prevent severe illness. And third of all, we really need a very ongoing, solid testing strategy that people can test themselves very frequently without any problems and stay at home when they're positive. Once that's in place, then, our future will look much brighter.
A couple other things. I have a lot of friends that think that this is just, or the latest phase, Omicron, is just a quickie. A couple days, they feel better, it's no big deal after they've been boosted and had their shots. I think that's the wrong mindset for people to have. Are you hearing that? And how do you convert the discussion about this so that people really take it seriously?
Yes, you're exactly right. And for many fortunate people, it is not a biggie, so to speak. However, if you have 1,500 new cases a day, new infections, let's say, most of them will have minor illness. However, 1% will end up in the hospital and many of them will die. So 1% of 1,500 people is a lot of people. We've had around 150 people in our hospitals now for the last week, and our intensive care unit rate is going up. So you do not know whether you end up as one of the fortunate people who just has like a bad flu-like illness, or you end up in the hospital. So that's why just to brush it off as it's no biggie is very risky and not well advised.
All right, thank you very much. I think in the next week or two, Joey's going to be talking to you a lot about football parties, the Super Bowl party, Super Bowl spreaders, and more. And one of the greatest lines you ever said to the Board of Supervisors, and I can quote you, was, "If people think this is a flu, by no means," is what you said. And we've talked about it a lot. So thank you very much for those words, and of course, enlightening us every week here in this segment. We'll see you next week. Thank you.